8:13, hot all the way through the Memorial Day weekend. And then June's going to be hot too. And I hate to tell you this, but July, hot. August, hot. September, hot. October, hot for the most part until maybe Halloween, sunny too. That brings us to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, who is here to talk about skin cancer. Good morning, Dr. B. How are you?
Hey, Tommy, I'm good. Getting ready for the long, hot run.
Yeah, you go. It is a marathon, not a sprint. Nearly 1 in 5 people develop skin cancer in their lifetime, and while most cases are curable, it's important to find and treat skin cancer in early stages. And that's what Dr. B from People's Health is going to talk about, warning signs of skin cancer and how to protect yourself from the sun. And I guess the first question, Dr. B, is what causes skin cancer?
Yeah, so, most people know this, but the main cause of skin cancer is actually overexposure to ultraviolet light. And those UV rays that we call them really come from the sun. So here in Louisiana, that's really our biggest exposure point. But you have to also be a little concerned about things like sun lamps and tanning beds for anybody that uses those, because that can increase your risk as well. And what happens is those UV rays actually damage the skin, and they cause abnormal skin cells to form. And if those abnormal cells start to divide and grow out of control, that actually creates a mass of cancer cells, and that's what becomes skin cancer.
Are there any particular places on the body where skin cancer can develop or is likely to develop?
Yeah, as you can imagine, because sun exposure is the biggest risk factor, it usually happens in parts of the body that get a lot of sun. So usually we're going to see it on the face or the neck. In particular, the arms, we see them quite a bit because people don't think about that. People who drive around in their cars with the window open, that can be a big exposure, and you don't notice it because you don't get hot usually with the wind blowing on you. But really, skin cancer can form on any area, any part of your skin, even areas that don't really see the light of day. So you can find them even in your bikini area. You can find them on your heels or the palms of your hands even. So really, skin cancer can happen anywhere that you have skin.
Beneath your fingernails even?
Yeah, even there. And, you can imagine if you get a whole bunch of sun exposure and those UV rays can pass straight through your nails, and you can actually get a little cancer underneath your fingernails.
I played a ton of golf in my life without hat, without sunscreen. I got a friend of mine that I played with that always used sunscreen, and he had a rare type of cancer, and he damn near died from it. So I know how important this is. What increases, doctor, your risk of skin cancer?
Yeah, absolutely anybody can get skin cancer, but the one of the biggest risk factors, like we said, is the sun. So if you spend a lot of time in the sun, you've got a much higher increased risk. Golfing, that's a very good example of that. And then people who do get sunburned more easily than others are going to be at higher risk. Some people that have a lot of moles on their skin, that can actually confer a little bit higher risk as well. And it does run in families. Skin cancer definitely runs in families. So if your mom or dad or brother or sister has skin cancer, you're more likely to have a problem later in life. And, the other things we definitely talk about, there are certain physical traits that people can have that put you at higher risk. People that have light-colored eyes, so blue or green eyes, people that have blonde or red hair, or they're fair or freckled in their skin. That means they have less pigment in the skin and less kind of innate protection from those UV rays.
So that, like, some people are more olive skin than others?
Yeah, so if you're more olive skin, your risk is a little bit lower, but it's not an absolute, reduction in the risk of skin cancer. People with olive skin definitely can get cancers.
And people of skin of other color as well. There's a myth that skin cancer doesn't affect people of color. Why don't you talk about that?
Yeah, and that's a completely false myth, definitely. So, people with darker skin tones, people of color actually can develop cancer, and that skin cancer really in darker complexions sometimes can be even a little bit more difficult to find because if the manifestation of the cancer is a darkening of the skin, you may not see it as well. So, in darker skin tones, it's more likely to form in some of those areas that aren't normally exposed to the sun. Like I mentioned, the palms or the soles of the feet can be two areas we really have to watch.
Different kinds of skin cancer, I presume?
Yeah, there are, and really we kind of group them into two areas, two types of skin cancer, melanomas, which I'm sure everybody's heard of, and then non-melanomas. So melanomas are definitely the most dangerous type of skin cancer. They come from a skin cell that produces that coloring, the pigment that gives your skin color, called melanin, and actually they're produced by melanocytes. And while melanoma is much more dangerous, it actually only accounts for about 1% of skin cancers. But unfortunately, those cancers are usually pretty devastating. It causes the most deaths. And then non-melanomas, the other major type, is all the other types of skin cancers that we see. And most often that would be either a basal cell carcinoma or a squamous cell carcinoma. And then there's a bunch of more rare types as well.
Somebody brought up a point about Jimmy Buffett, how he had a wonderful life and was very, very lucky, but unlucky in that he caught or had the one kind of cancer that took his life, right?
Yeah, and he actually passed from Merkel cell carcinoma, which is a non-melanoma skin cancer that is very, very rare, but very devastating, obviously, by what happened to him.
What are the warning signs of melanoma, Doc?
So, typically what you may see is a little bump or maybe a mole. Sometimes it can present as scaly patches on your skin, and some people may even develop almost like an open sore, like something that looks a little bit like a blister. And so we use something we call the ABCDE rule to help you find spots on your skin that may be concerning and that you need to go talk to a doctor about. So, A stands for asymmetry, and that just means that the spots on your skin are irregularly shaped, so they look kind of funny. B stands for borders. So if you've got real clear, distinct borders like a lot of moles have, that may not be as concerning. But if they're blurry or uneven borders, that's something that needs to be looked at. And then C stands for color. Color is typically moles are one color, and if you see multiple colors in a spot, it needs to be checked. D is the diameter or the size of the spot. So if you remember those old number 2 pencils with an eraser on them, if you can cover it with a pencil eraser, then you're probably okay. If it's bigger than that, it needs to get checked out. And then E stands for evolution, and that just means change. So cancers change over time. So if you have a spot that's been there for 10, 20 years and it's never changed, you're probably fine. But if it's changing color, shape, or size, you definitely need to talk to your doctor or a dermatologist right away.
Well, let me take a break. We'll pick it up here. We come back talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Some very timely information as we approach the Memorial Day weekend. A lot of people spending time in the sun, whether it's playing golf, hanging around the pool, fishing, you name it. We'll talk about some other tips for spotting melanoma when we come back. 821 Traffic Now, WWL. 827, Tommy Tucker, WWL, talking to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about skin cancer. We've already talked about some warning signs of melanoma: asymmetry, border, color, diameter, evolution. Any other tips, any other tips or other, Doc, for spotting melanoma?
Yeah, we do use something we call the ugly duckling tool, which is really exactly like it sounds. If you're looking at your skin and you see one spot that looks funny, kind of the little ugly duckling spot, then that's the one that probably needs to get checked out. So it's just kind of a quick and easy you can use.
And do those type of tools that we mentioned work for other kinds of skin cancer?
They can, but the non-melanoma skin cancers sometimes look a little bit different. They can, like I said, they can present sometimes like an open sore or an unusual bump or maybe even a rash. And so sometimes those tools are not as good for non-melanoma type skin cancers.
How can we protect our skin?
I mean, the best thing you can do is be aware of your skin. Check your skin often because you're probably the one who's going to notice it, or get your partner to look, like on your back in particular, because you're not going to be able to see that. And then don't put off visiting your doctor. Your doctor's probably going to do what we call a skin survey, see if there's anything that looks unusual to them. They may even take a picture of something, so when you come back in the next year, they can see if it's grown or if it's changed in character. Just don't ignore the warning signs.
And how about protecting our skin from the sun specifically?
Yeah, and this is so important, especially here in Louisiana now that we're getting into the summer. You want to really use a broad spectrum sunscreen, something that's got SPF 30 or higher, and you really need to wear it every day. Even when it's cloudy and rainy, you can actually get a sunburn, and any sunburn increases your risk for skin cancer. You want to try to make sure you apply it 30 minutes before you go outside, too, so it's got time to soak into your skin. And then if you're going to be in direct sunlight, say you work outside or you're going to be taking a long walk or something, try to wear some clothing that actually covers your arms and legs. And don't forget your eyes. You want to make sure you protect your eyes with sunglasses, maybe a broad-brimmed hat. And then the other area where I've seen some problems is on the lips. So make sure you're using a lip balm with SPF as well so you don't burn your lips.
Some other things to stay safe?
Yeah, I mean, one of the biggest is don't use a tan bed. Tan beds do emit those harmful UV rays. They're very intense. You can burn very quickly in those. So if you want to look tan, there's a lot of self-tanning lotions that you can use that'll give you the same effect. And then one other thing to keep in mind, a lot of people don't realize, some prescription medications, in particular some types of antibiotics that you may be on, can make you more sensitive to sunlight. So if you're on any medications, make sure you talk to your doctor or the pharmacist about whether or not the drug you're on makes you sun sensitive, because that can make you burn much more quickly in the sun.
It's a good idea, Doc, to have a dermatologist or your doctor do a once-over on you every year. Just make sure.
Yeah, I mean, it's really a great idea to have somebody, who doesn't see you every single day look over your skin, because they're going to identify something more quickly than you may, because you're seeing your skin every single day.
And when it comes to skin cancer, it's the kind of thing you're going to see more than you're going to feel?
Yeah, typically. We do, like I said, in those non-melanomas, you may feel a little bump, but most melanomas are completely flat, so that you're not going to usually see something raised.
Very valuable information. Thank you, Dr. B. Have a great Memorial Day weekend.
Thanks, Tommy. You too.
Dr. B, Chief Medical Officer of People's Health. You can visit, if you want to find out more about People's Health, you can visit the People's Health Medicare Center. That's at 3017 Vets, right next to Party City. Appointments are recommended, but walk-ins are welcome. They'll help you. You can also visit their website, peopleshealth.com, or call them at 1-800-978-9765. Go to peopleshealth.com. We come back, we're going to talk about Folds of Honor as we approach the Memorial Day weekend and what they do to help disabled service members with scholarships. Right now, time for WWL First News.